This is an ACL reconstruction. Here is the ACL that is torn. We're removing the torn pieces. We leave a little bit of a footprint on the tibial side. We remove all the tissue from the femoral side so we can see the anatomic landmarks. I personally do a anatomic ACL reconstruction where I identify the landmarks myself rather than do a one-size-fits-all approach. So once we remove the tissue from the femoral side, we identify the anatomic location of the ACL. We put a guide wire there after we mark it. Here the guide wire is going in. We take that out the opposite cortex. We measure the length of that, and then we over drill it with whatever size drill our graft measures. We typically drill to about 25 to 30 millimeters. Here we're drilling to about 28 millimeters. Remove all the bone dust from the area so we have a nice clean tunnel. After we remove all the bone dust, we pass a suture. This is what we use for later graft passage. There's a nice anatomic tunnel from the femoral side. Then we use a flip cutter guide on the tibial side. We advance the flip cutter, we flip it, and we pull back to the depth of approximately 28 millimeters to 30 millimeters. We remove all the bone dust from the area, and then we pass another suture. At this point, we take both of our sutures, once we've passed them, and pull them out of the tunnel, and we pull them out of the skin, and this is what we use to pass our graft. Here we're passing the tightrope, which is what we use to fixate our graft. Then our graft is coming into place. That's on the femoral side. We pass it on the tibial side, and then we tension the graft appropriately. Here's a nice anatomic ACL reconstruction, very nice graft, good tension on the graft. We tension a little bit more, and at that point we're done.